Hello, everyone. It's my pleasure to welcome you today to Susan G. Komen's virtual MBC Impact Series event. My name is Casey Volpe, and I'm with Susan G. Komen's Community Education and Outreach team. The programming for this series is envisioned as a year-long conversation with attendees, presenting new information and speakers each month. Many topics requested from the MBC community. Today's topic is research and health equity, and we have two fabulous speakers for you. We have Dr. Jerome Jourquin, Senior Director of Data Science at Komen, and Dr. Melissa Bondi from Stanford Cancer Institute. Before we begin, I just need to thank our sponsors for supporting the 2023 MBC Impact Series. Thank you to AstraZeneca for being the technology sponsor for this year's event series. The virtual setting means that MBC patients, no matter where they live, can be part of this community. We also would like to thank our premier sponsors, GE Healthcare and Merck, and our signature sponsors, Walgreens and Daiichi Sankyo. Thank you again to those sponsors. This series is made possible because of their generosity. So just a quick housekeeping note, while our speakers are talking, feel free to post your questions in the Q&A feature in Zoom, and once the presentation is done, we'll get to as many as we can. So very excited to dive in with you all today. And to start, I'd like to introduce you to our moderator, Missy Van Lokeren. In June 2014, Missy was diagnosed with invasive lobular breast cancer. Since her recurrence to MBC in late 2018, she has dedicated her time to patient advocacy. She is very proud to work with Susan G. Komen. She represented Komen on the Hill and spoke to Congress members about MBC patient issues, and she interviewed two renowned doctors at the National MBC Conference. Last year, she was a patient advocate reviewer for 6 grants on redefining metastatic breast cancer. She is a patient advocate on 2 grants awarded from Komen that bring Duke and University of North Carolina labs together and in a cooperative to study and lead to new treatments and cures for metastatic breast cancer. She's been involved in fundraising for MBC for the past several years for Komen. She chose not to let MBC define who she is, but instead to help researchers with projects that will improve the patient experience and outcomes. She believes there may be a cure for metastatic breast cancer and wants to help make it a reality. Missy also serves on Komen's Metastatic Breast Cancer Steering Committee, and that means I get to work closely with her, and it has been a pure joy, and she is a fierce advocate for all things research. So Missy, the floor is yours.
Thank you so much for that kind introduction, Casey. I'm so excited to be here today because research is my passion. Ever since I was diagnosed with metastatic breast cancer, which many of you on this call hopefully can relate to, it is a devastating diagnosis and there is no cure. So I decided instead of, folding up and just letting this happen, I was going to get involved and I was going to get knowledge. Knowledge is power. And I decided to find out about research, what's going on, where are we going, and how can we get to better treatments and a cure. The medicine I'm on right now, Ibrance, was not even available 7 years ago. So that just goes to show that research is keeping us alive today. So I'm so happy to be an advocate for researchers and also to be the voice of patients to scientists who really do want to know how we feel and if they're going in the right direction with their research that can lead to better lives for all patients. So without further ado, I would like to talk about our first guest, which is Dr. Jourquin. Dr. Jerome Jourquin, welcome to the program. Jerome Jourquin joined Susan G. Komen in January of 2021. He is currently the Senior Director, Data Science, and oversees Komen's Big Data for Breast Cancer initiative that aims at using big data to fuel scientific discoveries and accelerate the delivery of equitable, patient-focused care. In that role, he also oversees Share for Cures, Komen's breast cancer research registry, connecting researchers with information from people who have or had breast cancer. Prior to joining Komen, Dr. Jourquin completed a BS in bioinformatics at Vanderbilt University, where he developed GLAD4U, a National Library of Medicine Award web service designed to build prioritized gene lists based on user queries. At Vanderbilt, Dr. Jourquin was also part of a multidisciplinary team of experimentalists, mathematicians, engineers, and bioinformaticists studying breast cancer invasion. Dr. Jourquin, a French native, earned a PhD in neurosciences and an MBS and an MS in cell biology and animal physiology. His research studies have been published in various scientific journals. Welcome, Dr. Jourquin. The floor is yours.
Thank you, Missy, and as you love research, I'm sure you love how we write about things that, bunch of terms that is really hard to read. What I wanted to start with, and I have Dr. Bondi who's going to join me when I'm done with my little presentation, is really introduce to everybody what ShareForCures is. So I'm going to share my screen. I only have a few slides. So I'm not going to bore everybody about what we do, because we want to hear your question and, more importantly, answer them. So I think I am sharing my screen, and we'll go with that. So when we talk about ShareForCures, I mean, I love to hear about, people like Missy who really have a passion for research, because this is really where it started. I love also the description that she has about making sure that researchers like myself, like Dr. Bondi, not just work on things that seems interesting, but things that matters, and especially matters to patients and to people who may face breast cancer or are facing breast cancer. ShareForCures started in that scope, in the sense that we had conversation with patient advocates, with researchers, and figuring out that really we needed a place to really empower people to participate in research. And for us, it was really important with ShareForCures to design that. So ShareForCures, in a nutshell, as you're seeing on the slide, it's a breast cancer registry that Susan G. Komen is operating, that's really connecting researchers with information from people who have or had breast cancer. And that's really what's important. If there's one thing to remember from today, has all the information we're going to provide, is that connecting researchers to people who have or had breast cancer. That grassroots approach, making sure that we get the information from people who face breast cancer, we get that information from them, provide that information to the researchers, that they can help really with that data that we're collecting to really drive the research that they need to do to make, our mission of finding breast cancer, finding the next treatments, the next breakthrough, whatever it might be that patient need, a reality. So when we talk about ShareForCures, we also wanted to make sure that what we create, and we're going to present a little bit where we are today in terms of what to expect if you were to consider joining ShareForCures, which we hope you do if you haven't already, is the idea that we're building something that is going to grow over time. What we're collecting today, we're going to keep on adding, because again, the better picture that we have about everybody's breast cancer, the experience that they live through, the journey that they have going through treatment, through the diagnosis, whatever that might be, is enriching the data that we can provide to research to answer the questions that we still have today. So in a sense, when it comes to research, we always start, at the end of the day with the eligibility criteria. And so, what we wanted to do with ShareForCures is making sure that we're opening for the maximum number of people as possible. So what you see on that slide as well are like the 3 eligibility criteria that we have. So if you are an adult in the US and you have had a diagnosis of breast cancer, whether you're living currently with breast cancer, like probably a majority of the people listening to us today, or you had a diagnosis 30 years ago or yesterday, it does not matter. You are eligible to participate in ShareForCures. Again, our goal is really to bring a really large proportion of the breast cancer community, so that we can learn from everybody who have breast cancer and developed, trends in the data, whatever that might be, provide that resources to researcher to answer all the questions that we still have today. Okay, so let's say that you decide on joining ShareForCures. So what happens once you click that join button on our landing page? So as I mentioned, this is kind of the little road that you will take with us to really get into ShareForCures. Once you click that button, we're going to verify, you're going to help us with that, making sure that you're eligible for ShareForCures. Again, those 3 criteria, being an adult in the US with the diagnosis of breast cancer is all you're going to have to, quote unquote, show to be able to kind of start your journey in ShareForCures. And joining means that because we have an online platform to really kind of collect that data about you directly from you as well as on your behalf, is to create a new user account so you can actually connect to the platform. Then if you're familiar with the research process, super important, you're going to be presented with the informed consent form, because whatever we want to do, we want to tell you that up front, so you have all the information that you need to make the decision as to whether to participate or not. So that informed consent form, it's, again, if you have been in research, it's super important, the feedback that we have received, making sure it's in plain language. Unlike my bio, that Paul Massey was very good about telling you who I was or what I came from and what I did. The informed consent is in plain language, so you can understand what we are trying to do and have that information when you decide on joining. Then you are being presented with a medical records release form. So actually, we ShareFocus in terms of data that we're collecting. We want to collect, information from you, but as well, your medical record is a place where we can learn a lot about your breast cancer, the treatments that you have had, but also other conditions that, not just condition, but actually who makes you as, when you present with breast cancer, you have a health history. You have all of that in your medical record that we want to make sure we can provide to researcher as well. As I mentioned, we also want to collect information about you, from you. So you have questions to answer, things such as where do you actually getting care? So we know where to get your medical record from, but also, some demographics information that we want to make sure we capture as you're joining ShareFocus. And then when you do that, you're presented, which is on the very right of your slide, what the dashboard, the ShareFocus dashboard. Again, as I mentioned, we have an online platform for you to be able to participate in ShareFocus. And that dashboard is really where we, going to interact with one another through that online platform. This is where you're going to find information that you provided us. The questionnaires that you answer, for example, you'll be able to find the answers you provided on that dashboard. That's also where you'll be able to contact us if you have any questions. That's also where we're going to be able to provide information to you, such as, if we have additional opportunities for you to do X, Y, or Z, the dashboard will be a place where we can provide that type of information. But importantly, with ShareFocus, like for you to join is really just one side of the equation, not to get kind of scientific with you. The equation is ready for you to not just join. Of course, we want you to join, but we also want you to be engaged. So as you're joining, this is really just one half of the story. We want to make sure we establish that relationship with you, so we keep on learning from you as to who you are, how you are doing, and again, anything that may happen to you that may be relevant to research, we want to capture that over time, not just on that one time at the beginning when you click join, but over time, because again, we are all very facing complicated circumstances in our lives, and we want to make sure that that is taken into factor when we actually asking the question and providing data to researchers. So one of the things that we're going to do once you join, when you access the dashboard, the thing that's going to happen are, for example, on that slide, you see provide a saliva sample. So one of the data that we want to collect are, risk factors. And what we're going to do is doing genomics on your saliva samples to kind of establish that, again, something that researchers are using pretty much on a regular basis to establish, what might be in your genetic background of importance to, some of the conditions you may be facing or predisposition or whatever that might be. We also, as I mentioned already, going to collect medical records. And the reason we're doing that, as I mentioned, is to, again, learn about what care you receive, what conditions you may be facing with your providers, and what treatments you may have gone through. Because, what we've learned from talking to, when we had focus group, when we were planning ShareFocus, is that all that information, as this crowd knows, is very complicated very quickly. And we didn't want to put the burden on the participant to actually have to remember every single detail as to what their experiences has been, especially when it comes to medical provider interactions. So one of the best way for us to do that and not put that burden on the participant was to go on behalf of the participant directly to their medical record. So that's what we do there. And then, since we want to learn from you, We want to keep on, providing the opportunity for you to answer questionnaires, which will again start adding more, context to what your journey in the breast cancer has been, what your experience. You participants are the best people to really tell us, the researcher, what has been, the outcomes that you're facing, what has been the challenges that you're facing. And so here on this slide, you actually see 3 examples of questionnaires that we have ready to go. But as I mentioned, this is something we're going to go over time. We're going for the long game over here, because again, there's so much to learn from you and from people who have faced or live with breast cancer. So those 3 examples right now are the quality of life. Again, what circumstances maybe you may be living in that may affect your quality of life. What are you experiencing? Family health history, also something that we know when it comes to breast cancer. This is one condition, but there might be breast cancer in your family or the type of cancer that we researchers usually are relying on knowing, so that we can again have a better idea or better context to your breast cancer, your experience. Is there anything that kind of is impacting that as you go? And then social determinant of health is another one where it's very important to be able to, again, figure out not just what your condition might be, but again, what is your environment? How do you evolve in your life day to day to make sure that we take that into account to better understand, again, who you are and what you're affected with, what you are facing. So that in a nutshell, I didn't want to take too much time. This is kind of a very quick overview of what Share4Cures is and what it will take for you to participate. We're going to introduce Dr. Bondi, but she and I are so thrilled to be with you today because we're super excited about Share4Cures. There has been 2-year love affair in a sense of putting that together with that continuous feedback from the community as well as the researchers to really put something in front of you that is going to be not just useful to researchers, but also useful to participants in the sense of what can we do to not just say we want you to participate in research, but you're really partners with us in that research over time. And with that, I will invite Dr. Bondi to come with us, and I think Missy, you may have kind of a quick introduction to do for Dr. Bondi.
Yes, thank you so much. Thank you so much, Dr. Jorcan, for that important information regarding Share4Cures. And now I'd like to happily introduce Dr. Melissa Bondi. Dr. Melissa Bondi is the inaugural chair of the Department of Epidemiology and Population Health, co-director of Center for Population Health Services, and the associate director for Population Sciences at the Stanford Cancer Institute. Before joining Stanford, she was the Associate Director of Cancer Prevention and Population Sciences and Section Chair of Epidemiology and Population Sciences at Baylor College of Medicine. Her research focuses in genetic and molecular epidemiology and is at the forefront of developing innovative ways to access the roles of heredity and genetic susceptibility in the etiology of cancer and outcomes, primarily brain and breast cancer. She has a strong interest in health disparities and had several studies investigating the familial association with glioma, ethnic differences in glioma, and germline and somatic associations with glioma outcome. She has been a longtime advisor to Susan G. Komen and served on their scientific advisory board as a Komen Scholar. She is currently the scientific director of the Share4Cures project. She served on the National Cancer Institute's Board of Scientific Advisors, where she provided direct counsel to the director of the NCI, and is member of the External Advisory Board for several NCI-designated cancer centers. In 2018, she received the Visiting Scholar Award from the NCI Division of Cancer Epidemiology and Genetics. Welcome so much. We're so happy to have you, Dr. Melissa Bondi.
Thank you so much.
It's so good to see you. And we're going to let you start with a really important question, and that is, how do you see this program increasing diversity that could improve breast cancer outcomes for people who are generally underrepresented in research?
Thank you for that question. And I think it's really important for the whole development of Share for Cures, and why I was actually interested in getting involved in being the scientific director and working with Komen on this project, because I've done quite a bit of research in minority populations and trying to understand more of the diversity and why I'm an epidemiologist, so I'm interested in why people develop cancer and trying to understand these kinds of things that are different in different populations. And, you know, everybody's journey is different. We had a large study in Mexico and Mexican Americans and looking at the role of acculturation and genomics. And we really understood that the intersection of these things really have a different effect on development of breast cancer, as well as the outcomes of breast cancer. And many researchers, I mean, this is a partnership, and I think that that Dr. Joaquin mentioned that, but it's really a partnership with our stakeholders, with patients, with researchers, to develop a resource that could be used on both sides, you know, trying for the participants and stakeholders to understand more about their breast cancer and what they could do about it, but also for researchers to have access to a large, well-defined and well-integrated database. And you can see that we're trying to collect multiple things like their medical records. We're trying to get genomics. We're trying to get epidemiologic factors, trying to understand people's journey, like how hard was it to get access to medical care? What happens along that road? And I think that picture in the image that that Dr. Joaquin showed is really what we're trying to do. And diversity is important, and most researchers have had access to maybe smaller populations. And our goal is to work with the community and work with stakeholders to have participants from multiple sectors of our community. And it wouldn't just be those that are that are underrepresented minorities, but we want rural versus urban populations. We want to include LGBTQ populations and really develop a data set that's going to be diverse, that's going to be attractive for research, because we don't understand much of breast cancer disparities and how these factors that we're hoping to be able to look at affect these populations. And so that's really critical for us to develop this type of a research infrastructure for people to access, and for our participants to feel proud that they were part of this these studies. And it's not just one study. We see this developing where multiple researchers will come up with ideas and new ideas, and that we will be able to expand this resource. That you know, just think of it as one project finishes, all of the researchers have to basically put their data back into this infrastructure so that others will have access, and it keeps building.
That's a great answer. And it's so important to get this data so we can find the reason for the disparities and really get some information out of it. Thanks so much for that. The next question I have is, after enrolling, is my data safe? Who would like to answer that? Would you like to answer that, Dr. Joaquin?
Yeah, and please call me Jerome. That's all good. You know, that actually Dr. Joaquin, sometimes it takes me a minute to answer that. The idea, yes, I would love to answer that, because that is super important as well. I mean, you know, when it comes to providing your information, there's nothing more important than respecting your confidentiality and making sure things stay private. And I would take that, you know, it was pretty much one of the first discussions we had in terms of what do we build in terms of a registry? Do we build something, you know, online? And what does it mean to make sure that, again, the data that we collect is remaining safe for people? So when we talk about, you know, like collecting the data, like Dr. Bondi was saying, you know, everything that we do, we are putting in place, making sure that it's the best practices in terms of transferring the data from point A to point B, making sure that everybody who needs to touch that data along the way has the right credentials, has the right training, to make sure that they understand that this is research data, that this needs to be protected, and this has to remain confidential, and that only a few people that really need to know whom their data come from actually know whom their data come from. And so in that sense, something, again, if you're familiar with research, ShareFocus is actually an IRB approved project. So again, we have that first, making sure that it's not just common, decided what's appropriate or not appropriate. We have an external body that actually verified, making sure that all our processes, our protocol for the study is actually, again, best practice and have the right protections in place. When it comes to, we're going to tell you all day long, we want researchers to access that data. That's what Dr. Bondi was saying, because at the end of the day, that's one of the goals of us aggregating that data into ShareFocus. Well, what we're going to share is, of course, the identified data. We want people to have an idea of what makes a person by all the data that we can collect about that person. But we don't want them to know who that person is, and we can put everything in place to make sure that stays confidential again. So, I can go on and on because that's really something that we take very seriously. But again, we encourage anybody who want more information, who have more questions, like a little plug from us, our landing page is sharefocus.org. There's a FAQ, frequently asked questions, and there's a whole section around data privacy and security.
Great. That's a great answer. It's really important for patients, and I appreciate that answer. The third question I have is this in an app for those who may not have access to computers?
Yeah, and I can answer that one too. So, I love to be super trendy and tell you we have an app, like in whatever, store that you may have on your phone. But the reality, we don't. And there was actually an intentional decision that we made not to develop an app. So to bore you for half a second, the idea of an app, it's, once you develop the platform that we have, for example, it's not that you push a button and you have an app. It's a completely different development that you have to do. However, we wanted to make sure to that point, because we know, again, learning from our community, we know that nowadays you're not like me, where you're actually more of a computer person than you are a phone person. The world actually is not like me. The world is majority people interacting with their phone. And so what we did with the platform we designed to make sure that was responsive, as they tell me to call that, in the sense that, if you look at it on the computer or you look at it on your phone, it does shows appropriately, meaning that it does, if you look at it on your phone, you can do everything on your phone. The platform will adapt to display the platform in a way that it makes sense on the phone, and the same on the computer, so that it is really platform independent, if you wish, as to whether you say you go on it from a computer or laptop or phone, that you can really interact with the platform, whichever device you want to use.
Okay, well, I think that's important that they can use their phone for that. That's a good answer. All right, I have some more questions coming in. How can we help you reach groups of people? The patients want to know how we can help you.
You want me to answer that? I think that's a terrific question, because we're going around to so many different groups and stakeholders and community organizations, church groups. I mean, as many groups that we can get access to and encourage the runs, every event that's imaginable. We are asking people to consider participating, to learn more about what the project, the study is about. And so you can help us to promote the study, to encourage people to join. And that's hopefully what each of these presentations and our contacts with many different groups will allow our partners to be able to help us to encourage participation.
Okay. And would you like us to reach out on social media? I mean, a lot of us have platforms on social media where we might be able to help you get the word out.
I think that would be great. And if people would say, I joined for this reason, I think you should join. We've done a lot of focus groups, and people told us in these focus groups, if we knew that somebody we trusted joined, that would make us more interested to participate as well. So we want to get the ball rolling. Social media helps, and people saying, I did this and why I did this and why it's important. And I think that only can help for others to want to participate in this study as well.
Great. I think people will be happy to help that way.
Great. Let it go. We want this.
Let's do it. Yeah.
Yeah. Get it going.
There we go. All right, here's some more questions coming in. How many people need to be enrolled before the information can be used by researchers?
I'm going to let Jerome answer that because there's never enough for me, but go on, Jerome.
Thanks, Melissa. So yeah, I mean, this is actually a great question because it's one of my favorite answers that seems to be usable everywhere. Well, it depends. So basically, at the end of the day, you know, there's many type of research. There are many type of researchers, and at the end of the day, that how many people need to be enrolled? Well, for some people, they may just need, you know, data from 30 people, and they'll be able to do the research that they need to do. Some other people may need 3,000 before they're able to answer a question with the data we can provide. So for us, you know, we are really looking much more about enrolling people. This is really what's important to us because, again, it's not as much, you know, we haven't created Share4Cures to answer a research question. We're trying to create Share4Cures to answer a multitude of research questions, some that we may think about, some that we may not be thinking about. So we didn't want to kind of close our site on like, we need absolutely that number of people before we're able to open for research. More importantly, our goal right now is to make sure that everybody knows about Share4Cures so they can make the right decision for them to participate or not. Because at the end of the day, that diversity, that representation we're talking about is really what's more important to me than how people do we need before we can start research. Because if we start research with people who are not representative from the breast cancer community, we're not doing the right research. So again, like our focus right now is really on making sure everybody who wants to join can join Share4Cures.
So
able to do research, trust me.
The more the better, basically. Let's get people, let's get people in there. Okay, the next question is, why should I participate? And what have you heard are barriers to participation?
I can answer. Oh, you want to answer that, Jerome? I mean, why should people participate? Because, and it's not just for altruism, it's for trying to understand cures. It's for us being able to understand more specifically to specific populations that are more diverse. And it's just the more people we have participating that that provide their data, the more we can learn more about how to move forward and try to understand this disease and hopefully cures and special treatments. Because once we can start looking, and we know breast cancer is so heterogeneous, right? And why do some patients get metastatic breast cancer and some could be diagnosed and be cured for life? We need to know that. We want to know what puts different people at risk of recurrence. What puts people at risk of developing, you know, they already have breast cancer, so it's not the development, but really trying to understand more about the disease process, barriers, what kinds of things happened when they were trying to get treatment, and were there access issues, and, you know, really trying to understand social determinants as well.
Yeah. And are there barriers to participation?
I was gonna go right into that. So, you know, yeah, like right mind things alike. So, you know, because yes, one of the things that we did when we put Share4Cures together is, again, like we did focus group. We tried to learn from our community what was the issues that they may be facing or barriers that we're talking about to participate in research. And we probably all on this call have heard many of them, you know, like, well, I can't travel over there to participate in a clinical trial. I can't participate because the eligibility criteria are so narrow that I'm excluded. You know, I don't have, I can't miss work or whatever that might be. So in essence, when we created Share4Cures, an online platform, wherever you are, you can access this if you have access to internet, again, regardless of your device. You know, you don't need to go anywhere. You don't need to do that on a specific time because, again, you know, middle of the night, middle of the day, whenever it's convenient to you, the platform is available. And then, you know, in the sense of eligibility criteria, we tried to keep it as broad as we could to, again, include the majority of the breast cancer population into Share4Cures. So in essence, you know, when we created and planned for Share4Cures, we were thinking of those barriers that we didn't want to have. Now, of course, you know, nothing is perfect. So we know already that, you know, we kind of don't talk about that for quite, but kind of alluded to it. If you don't have internet connection, it's going to be hard to get on an online platform. So we know that there might be few things that we need still to address when it comes to barrier to participate, but that's something, as Dr. Bondy was saying, we're keeping an eye on that because we're learning as we're doing, because again, we talk to the community, we are implementing based on the feedback that we have, but we also keep on learning from the community as we go, and we're going to integrate that feedback into how we modify or can make participation even easier.
Great.
So one of the questions that I saw come up is about if people decide that they want to participate and then later change their mind, that anybody can always recuse themselves from the study and we delete their information. And that's part of the consent process where they're told that. And on every research study, everybody has that option if they decide they don't want to continue participation. We spent a lot of time with focus groups and engaging the community to understand the kinds of things that would be barriers for them to participate. And we have multiple committees that we work with, that community groups and other activities that we, as Jerome said, we're constantly monitoring the temperature, as you say, of the community and what's important and what isn't. And we certainly consider all of those kinds of things constantly. This is a moving target, and we're always here to listen. And those people that want to participate that don't have computer access, I think you mentioned that, Jerome, they can call in and we're happy to take this information and enter it, help them enter it as well.
Good. Another question we have is, how many people do you expect to enroll this year and in the next few years? Do you have goals in mind?
That's a really interesting question. So, if you listen to me, please listen to me. I want everybody in there, right? That's eligible. So it's like, in terms of how many people we expect, we really are trying to welcome everybody who is eligible. However, when we looked at similar study, what can we do to make sure that people have the information that they need to join? We are looking for probably a couple of thousand people to join in the first year, and then to keep on growing on that number year after year after year. I mean, when we think of, again, who fits that eligibility criteria, I mean, we're talking about a very large population. So, it's going to take a while before we actually can turn another stone to find somebody who is eligible and may want to participate in Share for Cures. At the same time, I want to always balance that it's not just about getting people in, it's also engaging them, right? So as we are getting people into the platform, whether it's 10 people or 1,000 people, we want to make sure we also are providing that opportunity to not just, for them not to feel, okay, I pushed that button and nothing more has happened, I gave everything I had to give, that we are keeping that dialogue, as Dr. Bondy was saying, open, and kind of providing more opportunities, as well as providing back, whether it's, what results has happened with the platform. Hey, by the way, we have your medical records, here it is. You can see it for yourself, this is your information. So those type of things that we can do along the way.
And I think that, for the participants to be able to see all of their medical record information in one place, because we're collating it all and we know how fragmented people's care is. And so I think that's a real added value for people to have that information. They can share that with their physicians when they go to the doctor. And I think that that's really an important point, is that we want this to be shared. We want this to be where even the participants communicate with us. And I think there was a question about how often will we communicate with them? And that was something we really wanted to understand. And that was one of the questions we asked to our focus groups. And, we don't want to overburden people with lots of information, and we want to be cognizant of not not burdening them with too much information. And so they will have data and things available to them on the dashboard. And as people are proposing new studies and we need to get more information, we will then contact and do a blast about, here's a study, would you be interested in participating? So there's lots of ways that we will be communicating, but we're also cognizant that we don't want to be contacting people all the time. So we will do this judiciously and not overwhelming people with too much information either.
That's great information. Another question we have is, how long does it generally take to get all of my medical records into the program?
I think I'm going to take this one since
Please.
I'm living that life. It's, another one of those, it depends. Like one other thing that we again made the intentional decision to do is that, nowadays when we talk about medical records, we usually have a tendency to think electronic medical records, but there's a reason why I don't keep on saying electronic medical records or electronic health records, is because when we consider in Share4Cures retrieving medical record, we actually can retrieve electronic or not electronic. So we know that a lot of people don't necessarily have access to their EHR, the electronic health record systems that hospitals or place of care may have. So we make sure that we can access the medical record whichever way it is, which means that if it's already digital, ready to go, so to speak, push a button and here we have them, it can go pretty fast. And then we go to a process to actually have healthcare professional go through that record and extract the information that is relevant to researchers. So all of that process can be from beginning to start, probably I would say 4 weeks. We can see records coming back. But if you're thinking, we have to fax records over, or we have to go back and forth with the providers, like I'm learning myself everything that I learn patient complain about when it comes to, interacting with their place of care and accessing their own information. Sometimes it can take, we started requesting those records probably 5 months ago. We're still waiting on some. So, that process can take a while too. But again, that's one of the benefits that we want to provide participants, is we're going to take that on. They don't have to do that.
That is actually, makes a lot of sense, because a lot of these records may not be technologically updated, and once you get them, they will be. So that'll be a really nice thing for patients to have. And this is our last question, and that is, in your opinion, what is the most important research question Share4Cures will answer?
Well, I don't know if we can say the most important, because this is evolving. And so I don't know if we have a specific question that we think would be the most important, because we think there's going to be a lot of important questions that we can answer from this. Hopefully we'll do some drug discovery. Maybe we'll be able to really do more precision medicine and identify people at highest risk of recurrence to prevent that from happening. So to me, that would be what I hope would come from this research project, things like that. Jerome, do you want to answer that? You probably have a different, different ideas.
Not a different one, but I'll be remiss with the crowd that we're talking to today to not say, the Share4Cures is not evolving in some kind of bubble. It is a common program. So, some of the questions we absolutely want to make sure Share4Cures is leveraged to really answer is any question that comes around, how do we better treat or even prevent the most aggressive type of breast cancer? Because we all know, unfortunately, that, this is still, as you were mentioning, Missy, not a diagnosis when it comes to metastatic breast cancer that you want to hear for good reason. And so, those questions are important. And we want to make sure that Share4Cures is equipped to provide researchers the data that they need to answer those type of questions. So yeah, multitude questions that can be asked. And sometimes, as research goes, it's not necessarily the questions that may be important as much as what they found. The breakthrough sometimes comes from the tiniest questions that they started with. But again, we want to really power anybody who has questions that can help us in that fight to be able to leverage Share4Cures and the data that we collect on behalf of patients.
Well, thank you for all those answers. And I'm going to be real hopeful and say, let's find some cures. How about that?
We're with you.
Yeah, let's do it. So thanks so much for all this information. This is just such a great project. I'm so excited about it. And I'm going to pass the mic back to Casey to close us out. Thank you. Thank you, Dr. Bondi, and thank you, Dr. Zhorkin. Appreciate it.
Pleasure.
Thank you. Really appreciated the invitation.
Thank you again so much to our just fabulous speakers. This was an amazing discussion. I learned a lot. I'm sure our audience learned quite a bit. So thank you again, Dr. Zhorkin, Dr. Bondi, and obviously Missy has moderated for us several times. She's starting probably to become an Impact Series celebrity, but we're thankful every single time she attends. So today's session was recorded, and it's going to be posted to our landing page, our YouTube channel, and also a recording will be sent out to everyone who registered. So you can view this session, you can view previous sessions. They're all divided by topics. So whatever your interest is, if we've covered it, it's there for you to peruse at your leisure. Please help us spread the word about this important content with friends, family, healthcare professionals, anyone you think would be interested in the Impact Series and the topics that we cover. So once again, I want to acknowledge our sponsors of the 2023 MBC Impact Series. Their generous support allows us to continue to have this community come together and to share important information and resources. So thank you to AstraZeneca for being the technology sponsor for this year's series, our premier sponsors, GE Healthcare and Merck, and our signature sponsors, Walgreens and Daiichi Sankyo. This series is made possible because of their generosity. So last but not least, I did drop a survey in the chat. If you have just a few minutes, please fill it out. It helps us gauge topics for the future, how we did today, any other questions that maybe came up after stewing on this information. And it's really helpful for me personally, moving the program forward to make sure I continue to provide the resources and information important to the audience. So finally, the next MBC Impact Series event will be on November 16th and is focused on brain mets. So we look forward to having you log in and join the conversation. And you can register now on our landing page, which is komen.org/MBC series. So thank you again for today. Thanks to all who made this event possible. Stay safe and stay connected.